Knowing the numbers for your glucose and hemoglobin are very important for your overall well-being. Glucose is a form of sugar, which is stored in the body and can be converted into energy. Hemoglobin is a protein molecule in red blood cells that is responsible for carrying oxygen from the lungs and transporting it throughout the body. If either of these levels are outside the optimum range, it is necessary to consult with your physician. To acquire this data for yourself, it is vital to see a medical professional, preferably a primary care physician who can order labs for you. Both hemoglobin and glucose levels are obtained by pricking a patient's finger, squeezing a small drop of blood into a slide called a cuvette, and are read using a machine called a Hemocube. The only difference between the two is that glucose requires a different type of cuvette in order for the machine to read the level. For this procedure, you will need the following: a Hemocube to read the slide, a cuvette, a lancet to prick the finger, an alcohol prep pad, a cotton ball, a Band-Aid, gloves, a paper towel, and a biohazard sharps container. You will want to have a clean and sterile space for the finger stick. All materials should be laid out in order prior to obtaining any samples. First, you will have the patient wash his or her hands and then shake them out to get the blood flowing. Then you will put on your gloves and ask the patient which finger he or she prefers. Warm up that finger with your hands by pushing the blood into the tip of the finger. Next, you will wipe off the patient's fingertip with the alcohol prep pad so that it is sterilized. You will then take the cap off the lancet by twisting and pulling it upward. Once you prick the finger, it is vital to work quickly so the blood does not coagulate. Swiftly and firmly press the lancet down on the right or left-hand side of the fingertip, but not in the center of the fingertip, as this can cause pain by hitting soft tissue. Dispose of the lancet in the biohazard sharps container. Wipe away the first drop of blood with a cotton ball and pick up the cuvette. Squeeze the finger until a large droplet of blood appears on the fingertip. Carefully place the very tip of the cuvette up to the droplet and it will fall right into the slot. Place the cuvette into the Hemocube and wait for a number to appear in the window of the machine. Place the Band-Aid on the patient's finger and dispose of all waste. Medical professionals monitor patients' glucose and hemoglobin levels because they can tell us two very specific things about the human body. Glucose levels that are high can indicate that an individual may be diabetic or pre-diabetic, while hemoglobin allows us to see if an individual is anemic or may need an iron supplement. This is a quick and easy way to determine if you are at risk for two common and treatable health conditions. Get your levels checked today. Thanks for watching.